Okay, we'll begin our second work session of the morning with the Clark County Opioid Abatement Council update. Please.
Great. Yeah, I'd like to start by introducing myself. I'm Jim Jensen. I'm with Carillon Behavioral Health. I oversee all of the justice system support programs for the Carillon regions, as well as do direct oversight in Southwest Washington of a handful of programs, including the Opioid Abatement Council. I'd like to offer the opportunity to jump in at any point with any questions or clarifications that you have throughout this presentation. So a few things that I just wanted to provide an overview while everyone's still fresh is that the requirement for the processes, the Opioid Abatement Council and the fund administration processes to adhere to the One Washington Memorandum of Understanding are all being followed. We've picked through that pretty well and are following all of those requirements. And some of the requirements are not set up yet. For example, submitting information to the state of Washington, their dashboard is not up yet. But we have created our own dashboard, which meets the One Washington MOU requirements. So even that is being met locally, even if the state dashboard isn't quite up yet. The Opioid Abatement Council was formed and then expanded to include a couple of leaders in our clinical agencies and a peer from Exchange Recovery. It is a 6-member board now, and we'll cover the membership here in a little bit. After forming, we developed a lot of the scaffolding, and Councilor Medvedji, you were there for this part where we were developing the charter and some of the standards and some of the policies that were necessary. And we created and then administered the request for proposals process with the guidance from the Opioid Abatement Council and held that RFP. And the council then chose 9 programs to support, and those contracts are now out to those agencies. 7 of those 9 have been executed. 2 of them are still in deliberation. Let's see. I did want to clarify that there are funds, additional funds in our region. The cities of Battleground, Camas, Vancouver, and Washougal are also receiving opioid settlement funds. But to my knowledge, they have not yet formed an Opioid Abatement Council and have not yet gone through the processes necessary to administer those funds. So we set up a timeline to try and not miss any of the important bits. We established the Opioid Abatement Council, developed the policies and processes for hearing complaints. The complaints meaning any of the local governmental agencies can file a complaint if they don't think we're spending the money appropriately, and we have a process for that. We developed the methodology for the RFP and then followed through with it, and we have developed the dashboard, which there's a link to that dashboard in the last slide of the slide deck if anyone's interested. That dashboard both maintains information about the Opioid Abatement Council and will be where we put the data from the contracted agencies that we collect. We've been giving quarterly reports to the county on this progress. Did you have a question or comment, Councilor?
Yeah, I didn't want to interrupt the flow of your thought, but between the last slide and this slide, I do want to make a comment and ask a question, because at the very beginning, very disappointed that some of this money got fragmented, meaning the city didn't join with us. The cities didn't join with us. Some have partnered with Vancouver. And so we had discussed policy-wise right in the very beginning that this is for all of Clark County. Yes. And people move around, and health providers have specific locations, but they're not going to turn someone away based on whether they're homeless or where they're living. So my point and question is this: now that the cities are going their own way, and so I disagree with that. I think we all should have had a unified effort with all of them sitting at the table, so we are all rowing in the same direction. and providing all the resources from the cities to the county. Is there a mechanism, in light of this slide as well, that we will continue the collaboration or ensure that we all are leveraging the money that each jurisdiction is receiving to provide the best care, to have the best response? Are there ongoing efforts with the cities? I apologize for withdrawing from this project, but I had to for very personal reasons. So what's happening right now with the collaboration with, have they hired Carolyn? I mean, do they have their own consultant? What's happening with the city money?
You know, I've reached out to the city to collaborate on their efforts and haven't heard back yet. I'll continue to do that outreach in a variety of ways and you know, keep being the squeaky wheel. My understanding is that Vancouver is kind of leading a collaborative of those other cities, and that my intuition by understanding the One Washington MOU is that they would then need to form their own opioid abatement council and develop some of the stuff that we've already developed for the county opioid abatement council. To my knowledge, they have not done that yet, but I am very open with whatever effort it takes to ensure that we are collaborating with their efforts, making sure they're aware of what we've done so we don't duplicate efforts, and we can really complement the work. So I'm committed to being that link between the Opioid Abatement Council for Clark County and the cities.
Thank you.
And I will also share where I have a monthly check-in with Eric with the city, and Amber will be joining me this week. We can bring it up with Eric and the new city manager that's coming in as well to see where they're at.
That'd be great. I appreciate that. Thank you.
Further questions or comments at this point? Please continue.
Thank you. Look, I didn't answer one of your questions. I'd like to answer it. They are not contracting with Carolyn, to my knowledge. There's been no approaches to us to manage those funds. All right. So we received proposals from applicants. We were happy with the amount that we received, although, you know, I have heard from a lot of agencies that I work with in my other programs, and I teach at night at Clark College, so I have some connections to agencies due to that work. And many agencies just weren't sure if they wanted to apply for this first round, but are very excited for the second round. So I'd be very surprised if we didn't have many more proposals the next time we run the RFP. The plan is to run it once per year, and in Q1 we'll be developing the second round of the RFP for the opioid settlement funds. All right, the awards were announced and the contracts went out. The current members of the Opioid Abatement Council are here, Councilors Young and Marshall, Dr. Alan Melnick from Clark County Public Health. Those three were assigned to the council, and after our first Opioid Abatement Council meeting, there was a request to reach out to a few other folks to see if we couldn't get some subject matter expertise, both clinical and recovery subject matter expertise. And the applicants that were added to the board were Dr. Kevin Fisher from Columbia River Mental Health and Jennifer Logan from Lifeline Connections. They both lead a variety of programs related to opioid use disorder in those agencies. And also reached out to Niles Hawes, who is a peer support specialist at Exchange Recovery. So one of the things I wanted to clarify is that there's sort of some guidance that we have, some Clark County goals that really give us focus and direction, but there's also these out-of-bounds lines, these requirements from the state of Washington that have been, some of them are pass-through requirements from the federal settlements. And so the out-of-bounds lines, the sort of guidance for how these funds can be used, were enumerated by and sent through the Washington AG's office, and are both part of a separate document, but I think they're also attached to the One Washington MOU if anybody's interested in looking. And I've summarized those here. I don't think we need to walk through all of them, but I will say they are relatively inclusive requirements. I think that the thing, if I can be bold enough to talk about intention, I think the intention is for these funds to end up helping the opioid crisis and not being diverted into other needs. And so that's why they have such a verbose description of the opioid settlement uses that are appropriate. Some of the key requirements from the One Washington MOU is establishing an opioid abatement council, establishing a complaint process, building a centralized public dashboard. Many areas are going to use the state one, and we will be submitting data to the state one as well, but we have established our own public dashboard so we could kind of get a head start because, so we can kind of zoom ahead and start putting this money to work. Obtaining and awarding proposals for use in opioid funds, and all the programs need to be adhered to this list I'm referring to from the AG's Office of Appropriate Utilization of these funds. Any questions about the One Washington MOU or so far, or comments?
Evidently not. Please.
Of course. So I talked, the One Washington MOU and the appropriate uses from the AG's Office of those out-of-bounds lines, but the council also met before we formed the Opioid Abatement Council and kind of gave some priorities for Clark County. And we have also used those as part of the scoring and rating of the proposals, and will continue to do so as long as these priorities remain as they are. The priorities primarily are around treatment, other areas including first responder and leadership planning and coordination, and prevention. And I think you'll see those represented rather well in the proposals that were awarded. So this is the part I kind of wanted to walk through a brief summary of the programs that were awarded utilizing the opioid settlement funds so far. So if you have questions about these as we go along, I'm happy to answer them. Otherwise, I'll just keep trucking through. I'll try to keep an eye on if there are questions. So the first one is the Boys and Girls Club. They are strengthening their opioid abuse prevention strategies. They have some programs that have been shown to have an impact that they're trying to implement both with their staff and with the individuals that attend the Boys and Girls Club. That's Clark County Fire and Rescue. I apologize. It should say Clark Cowlitz Fire and Rescue, but the program is going to be utilized in Clark County. And that's staffing for a full-time community health worker. That's someone who's, they already have a community paramedicine program at Clark Cowlitz Fire and Rescue, and one of the needs I think they saw was the need for someone to be able to do some care coordination and follow-up for individuals who maybe were, maybe there was administration of naloxone and, or there were some other issues that indicated a need for substance use disorder follow-up. Kook Collective, to increase their capacity, to expand their existing space and invest in outreach specifically for opioid recovery services. Columbia River Mental Health Services, staffing for medication-assisted treatment. I believe they're working to add a peer that can help with care coordination and connection to other services. ESD 112, these funds to directly go to prevention efforts, like the efforts that I'm familiar with at ESD 112 are the Starts With One campaign and the Lock Save Lives campaign, and so support those and others that ESD 112 is trying to do. Lifeline Connections to amplify the work that their jail transition services program is already doing to include some opioid specific supports, both clinical and recovery supports. Recovery Cafe Clark County, they asked for funds to rent a space close to some of the temporary and short-term housing support projects that so that individuals, including peers, but also other clinical agencies, could utilize this building that is just across the parking lot from a high-utilized and high law enforcement response area. Southwest Washington Accountable Community of Health, these funds are to support the naloxone vending machine network, as well as some youth prevention trainings. And then the largest chunk of money is going to the Clark County Jail Services. and this one is a bit, this one gets a bit complex because the essence of these services are to support individuals with opioid use disorder and opioid issues, to get connected to medication for opioid use disorder and help them in that transition to support the medication as they transition out of the jail. The reason it's complex is because the Clark County Jail is not a behavioral health agency. It's not a BHA. And so Carillon is required to, because they're providing clinical services, is required to contract directly with those who are providing those services. The jail had no problem with this. They didn't even want to take a portion of the money. They wanted all the money to go to the clinical services. And so we're contacting directly with Acadia Healthcare, who is going to be writing the prescriptions and doing some of the med management support, and Peer 360, which is going to provide the peer support for those individuals in the jail and transitioning out. I know I talk kind of fast. My night job is I'm a professor at Clark College, so sometimes I get on my horse and ride. But are there any other questions or comments about the awarded programs?
I have a question.
Oh, go ahead, Karen.
It seems that there are a couple of major threads going here. One is on prevention strategies, particularly working with youth. And then there's another thread on treating opioid use disorder. Both of those are pretty different from each other. So I'm wondering if there is considerable or any collaboration between those who are in those separate threads so that they can benefit from each other, particularly given that the magnitude of many of these grants, although extremely helpful, they're relatively small. So I'm wondering about that collaboration.
That's a good question. I don't know of any collaboration between the prevention and recovery programs that are on this list. I certainly think I agree that it's probably a good idea. I think one of the things we've discovered as we learn more and more about the opioid crisis is that it's not just an issue of prevention, early intervention, treatment, recovery. It's an issue of individuals engaged in our law enforcement, with our law enforcement system, individuals engaged with our housing systems and other support systems in our network. But on top of that, it's also a transgenerational issue. So if we help parents, we help children with prevention, we can have an impact. And so I think your sentiment is absolutely correct that there's things to learn from one another across these programs. And I'm not opposed to the idea of trying to gather these folks together and see if we can do a shared learning, but we haven't established anything to that point now.
I think that would be an excellent idea because there is a potential downside to too much bifurcation of the funds, where the collective impact is maybe less than it could be given collaboration and helping each other. For example, Boys and Girls Club, it's a marvelous way to reach youth, but it takes the expertise of this whole issue in order to be really effective with it. So yeah, I would support your doing that. I think that'd be great.
Councilor Marshall.
Yes, thank you. I wonder if the jail services will be pursuing whatever certification to be able to provide those treatments directly?
Yes, Councilor Marshall. In the mental health sales tax proposal that will be coming forward from jail services is part of that umbrella where the jail will be applying for the certifications needed to administer that in the jail along with our mental health services. So that's future planning, but in the interim, we definitely are very pleased with Acadia and Carillon for assisting us in the jail.
Thank you.
So I'm going to add a comment here. I think some of this, there is a culture shift on behalf of the state. We need help with the capital infrastructure in our jail. And that's a state interest on a number of levels. One is this mental health care and drug treatment within the population that we have housed involuntarily. But there's a real opportunity here that the state is pushing back against. You know, there's been separately a movement on the forensic side of things, the restorative care that the state is really struggling with. You know, they want to get away from the state mental health hospital prison model and diffuse it throughout the state so we have local treatments. But what they're missing is that, especially for that population that is also involved with the criminal justice system, we already have those facilities. And so they should be investing in our local jails to provide those treatment centers for restorative services forensically. And I will tell you, my personal experience as a judge was there's such an overlap between mental health and drug addiction. One feeds the other, sometimes one completely masks the other. But when I was referring, finding, okay, they can't participate in their defense, they need restorative services, what I found in the predominant number of cases is once they were clean and sober, once they were off the drugs, suddenly they were already there. They were restored. They didn't need that detailed mental health treatment because the drug addiction was what was pushing them over to the point where they could not participate in their own defense, and the criminal justice system came to a grinding halt. And the downside to that is for local struggling jails, you have this system where people cannot move forward in their criminal case, and yet there are no services to restore them, and it takes 6 months to a year to get them restored, when if they could be locally addressed, and opioids play the biggest role in that, polysubstance, is right, the solution is right here in our local jails or regional jails. If everyone could combine those efforts and realize we've got a population that is suffering, they're not receiving the mental health care that they need, they are languishing, and they're not being let out of jail because they committed a violent offense. It's inhumane, quite frankly. So I'm just proselytizing everyone here because I think we have opportunities to keep pushing on the state to say, we have a local solution, you have a local solution in every one of your county jails or regional jails in the state if you would just invest in it. So I'm hoping we can make some progress in that regard as other states are discovering that involuntary treatment is a huge part of the solution. And that takes a culture shift to recognize that. As much as people don't want to combine mental health treatment in our jails, they want to keep them separate. We can't keep it separate because most of the population is suffering from addiction and mental health that are also involved in our criminal justice system. So anyway, this is a good start. I'm hoping that we get the other settlement funds from the other ongoing litigation nationally, and that we can really make a concerted effort to focus our efforts in our restorative services, in our reentry program, within our jail. And just as one last side note, we have the triage services, we have secure bed space available, and it's being underutilized right now on the side of voluntary treatment. People don't necessarily seek voluntary treatment, so we have empty bed space that provide not only opioid treatment, but other polysubstance treatment as well as mental health, and somehow we have to fix that. Anyway, Amber.
Chair, can I make a quick comment on Councillor Bowerman's comment about the juvenile piece? I want to make a point to council that in the jail services umbrella, the medical contract is also for juveniles. So there's been a partnership that has been developing between Director Shook and Administrator Chris Simonsmeyer about what programs. They've been in a therapeutic approach for many, many years in juvenile. They have one of the best in the state, but how that translates from the main jail and also juvenile. So that partnership is starting to develop, Councilor Bowerman. So I just wanted to add that to your question about the presentation as well.
That's great. And it sounds like that could be a model for broader based participation with these other entities. That's wonderful. Makes a difference.
So it looks like the comments and questions are completed. Do you wish to continue?
Yep, I have a couple more things I might mention. First of all, I couldn't agree more, Councilor McVigie. I think you spoke very eloquently about the individuals who are suffering, and that's my passion. You know, I have a long history as a counselor and therapist, and before my work here, and that is my passion. I'd also like to assert, for those who that isn't an argument, to say that it is a public safety issue. That individuals accessing the mental health and SUD services necessary in the jail and off-ramping through diversion where possible, that makes our community a safer place. I think, yes, the last thing I just wanted to make sure everybody is aware of, and I believe they can have access to this, is a few of the links to the things we discussed here. The distributor settlement homepage, the One Washington MOU, and the list of opioid remediation uses from the AG's office, as well as the Clark County Opioid Settlement Funding dashboard that we referenced on the Carillon site, that is where the data will be posted once we receive data for our contracted agencies. And that's all I have. Happy to answer any other questions.
Councilor
Where
Marshall?
are those links found when we don't have access to that slide?
I believe the slides are on our website, Councilor Bowerman, so I can forward you the link.
I thought maybe it would, the links would be posted like on somebody's website where they were permanently available.
Yeah, so if you go, well, they might be, but if you go back one slide where he includes the links, all of those are on the presentation, and that presentation is on our website. So you can click on the links that way.
Okay. It might be good to have them on a permanent website as well, because those are great resources right there.
Councilor Bowerman, they're on a website, and maybe Dee Dee can chime in. They're linked on one of the county websites, as well as all of these are on the Carillon website. Dee Dee, do you know where these are located?
So we have a linkage between the information on the public health website to the Carillon website that is very specific to the opioid settlement funding. And then the Carillon website has a linkage back to the public health resource website.
Perfect. Thank you.
Mm-hmm.
Does that conclude your questions, Karen?
Yes, it does.
Thank you. Sue?
Great, thank you. First, Jim, I'd just like to say it's a pleasure to work with you. Carillon and you in particular have been really great in keeping the Abatement Council focused, being responsive to any additional questions, information, reaching out to the City of Vancouver. I'm really impressed. And I would just say that I'm also impressed with our Abatement Council. I think we've worked very well together. There's a keen interest in really getting these dollars out and putting them to work in the community, being able to collect what data we can, evaluate that, and be adaptive in the future so that we're making the very best use of these funds. I would just say Clark County, we're a leader in the state in terms of forming our council and getting those funds out. We've been very interested to your point, Chair, in collaboration and understanding what the city of Vancouver and all the small cities are doing, because these dollars, people will move around, and these dollars will be serving people from all jurisdictions. So as much as we can collaborate both locally and really understanding what's going on throughout the state, I think we're proactive in doing that. A couple of questions, though. If you could provide, and I know there's some things that are in flux, but a sense of how much and for how long these fundings may be available. And I know that with Purdue and the Supreme Court's decision, that provides a big uncertainty. But if we could get a sense of what this resource is and how long it would be available, that'd be great.
Well, this year we allocated just shy of $1 million, so $953,000, and I believe we have we're slated to have that much or a little more next year. And the idea is that it's going to be ongoing for quite a few years in that rate. But we did hear that there may be in 2 years there may be a slight downward trend in some of the funds. If the funds that were sort of expected from Purdue Pharma that was pushed back from the Supreme Court back to the lower courts, if those funds are not coming through, there may be a bit of a downward trajectory. I just don't know what it'll look like. The state said that, but they didn't give us any specifics.
And at some point in the future, and it may take years, there may be more funds once that's finally settled.
Exactly, and indeed, the intention, my understanding is that the intention of this structure with the One Washington MOU and the distribution to local entities is meant to be the structure for all future settlements regarding opioid distribution.
Thank you.
I'd also like to, if possible, emphasize what you said earlier to my knowledge, and I've been in some of the statewide meetings and meetings across the Carillon regions, Clark is ahead of every other county in the state that I've heard of. There may be some small counties or cities that have already gotten some money out, but as far as already contracting with agencies and getting the money out to the community, Clark County is way in the lead.
So I just want to add to that discussion. So first of all, I'm proud of that. And early on when I'm not going to put a name to it, but for the several mayors that I did talk to, not one of them had a hard feeling for whether they wanted to join us or not. And then they didn't. And so my sense was it was coming from the city managers, the city administrators, that they just wanted to go their own way. And that's really unfortunate because we have, we never contemplated, well, we're going to provide these services only to those who live in the unincorporated area of Clark County. It could not possibly happen. And that we have a limited number of key providers in the county that provide services here, and they're on our board. We have them. We've incorporated them. We're using them. And so are they going to get different direction from the cities? I don't see why this is happening. So I'm hoping that we can continue the discussions with the city councilors, with the city administrators and the county manager. I am very ecstatic with the work that you've been doing on our behalf. It's just perfect. And our stakeholders are participating and doing a great job on setting priorities for the county. So I just want to not take it as a fait accompli, but continue to work and try to incorporate the cities that we're all working together on this and forming perhaps a slightly larger council with them included so that we can all make the best use of this very limited resource. So anyway, thank you so much for everything you're doing. Thank you for the update. I think we are on track, and I think we can justifiably be proud that Clark County is leading in the state in these efforts. Thank you. So I think that concludes our work sessions for this morning. We do have council time resuming or starting at 1, so we'll be basically we'll adjourn this work session and resume at 1 for council time.